It is a great honor to welcome each of you here today to really launch our Rural Healthcare 180 Task Force, and we're very, very excited to be a part of this. Let me just say that Bill Lingenfelter, who is one, a personal friend, but a great individual and provides remarkable leadership, is the president of the Georgia and South Carolina Regions Financial Corporation. He and I are honorary chairs of this organization. And this is a wonderful public-private partnership that came together under Senate Bill 258. And I just wanted to say that Senator Dean Burke has been a great champion, a great asset. When this bill was brought to us, it underwent many revisions, and a lot of them were wee into the hours of the last day in the conference committee. But I think we came with something that all of us can be very proud of, and certainly the idea of hospitals doing a 180 turnaround, which is kind of what we have tagged, getting best practices in place and making sure that hospitals, particularly rural hospitals across our state, have a sustainable financial model going forward, and how a tax credit can be a part of making the necessary changes, and also to help sustain the rural healthcare network that we have in Georgia is very important. And this task force will come with many recommendations, programs that I think can be very beneficial, certainly to all of us. And so I'm very honored to be part of this. And with that, it's my great honor now to ask Mike Giles, who will provide the private perspective on the problems that exist and some of the meaningful solutions. Mike Giles is the Georgia Poultry Federation executive, and we're very honored to have him here as a task force member as well. So Mike, I'll turn the mic over to you.
Good morning. First, I want to thank Lieutenant Governor Casey Cagle and Senator Dean Burke for giving the Poultry Federation an opportunity to be involved in the task force that's going to be addressing this critically important issue of rural health care. On a personal note, it's very important to me. I had the pleasure of growing up in a very rural place, Dooley County, population 15,000 people. My hometown, Unadilla, is one of those places that you could describe literally as a single stoplight town. And city leaders finally, over time, decided that stoplight wasn't really necessary, and because there was no traffic, and they closed it down. But for me, my family, we many times had opportunities really to be served by our local healthcare providers. I was born in a rural hospital, so it's really important to me personally. On a professional level, the Georgia Poultry Federation has members that employ over 50,000 Georgians in rural areas primarily rural areas throughout the state. One of the most important ingredients of any successful business is having a healthy and productive workforce. Rural hospitals and rural healthcare providers provide a critical link in making sure that healthcare relationships exist between employers and the people in the community. From an economic development standpoint, if you look at companies that are looking to locate or expand in an area, one of the things that they look at, among many different factors, is what will be the quality and availability of health care for their future workers. I'm pleased to say that one Georgia Poultry Federation member, Claxton Poultry, has already pledged to be a participant in this by pledging contribution to Evans Memorial Hospital next year. So I predict that this will be the first of many businesses, large and small, in all different sectors, that are going to see the opportunity to help and participate in this program. Our job at Task Force is to get the word out. We I think we can do that through engaging with other trade associations like the Poultry Federation, getting the words out to employers that employ thousands of Georgians throughout these rural areas, working with chambers of commerce who understand the important relationship between healthcare and economic development, and with the hospitals themselves, who will be making, I think, direct appeals to businesses and individuals in those communities. Rural Healthcare 180 presents a tremendous opportunity to improve the state of healthcare in rural communities, and that's a good thing for Georgia overall, rural and urban. I look forward to beginning our work today with the task force, and I look forward to working with other task force members and trying to move rural healthcare forward in Georgia. I'll call on Senator Dean Burke.
Thank you, Mike. First of all, I want to appreciate all of you for being here today. I want to thank Lieutenant Governor for his leadership on this issue, as well as many other issues that are important to those of us that live in rural Georgia. I really never liked the term two Georgias. Unfortunately, there are times where it seems to fit, and one of those, I think, is at this time when we're talking about healthcare. We have poorer outcomes in rural areas, and obviously the financial challenges are much worse in rural Georgia. And, you know, I feel responsible for that. A lot of people ask me, why would a country doctor run for the state senate? And I tell people I love policy, and this is a policy I'm most proud of since I've been elected. I've served 4 years, and lucky enough to be here another 2 years. I'm sorry, Lieutenant Governor, I'll get to bother you a little bit more. But it is very, very rewarding to be able to see something like this come to fruition. I'm excited about that opportunity. To put a face on this issue, these are some of the challenges that rural hospitals face. Now, we've got a good number of rural hospital CEOs in the room with us today, and I'm sure they'll be available to discuss these issues with anyone who has questions for them. But they're facing the challenge of high numbers of indigent patients that are unable to pay their bills. We have insured patients whose deductibles and copays are so high they might as well be uninsured. And of course, the Affordable Care Act has come with some penalties of taking away dish payments and some other challenges that the hospitals are having to face. The future of healthcare, which I'm very excited about, I'm not a doomsayer. I think healthcare in Georgia will turn out to be just fine as long as we meet these challenges. And technology is going to help with that. And unfortunately, the analytic tools and the data that hospitals need to improve the health care of their population, of their citizens, is just expensive right now. And we've got to be able to put those types of new investments into these rural hospitals so they can succeed. And of course, rural hospitals are small, so they don't have a lot of resources, both from the capital standpoint to improve their equipment, as well as their grounds, their building. They don't have mature development programs to raise money, and they don't have mature PR people touting their horn like maybe the Children's Healthcare Plan and some of the other ones do. But to put a real face on the challenges, I wanted to invite one of our rural CEOs to speak on the issue. Kim Gilman is the CEO at Phoebe Worth from Sylvester. And, you know, those folks that live in Sylvester think they're in southwest Georgia, but, you know, Sylvester is about 100 miles north of where I am. So we welcome Kim to speak to us today on her challenges in this tough environment. Kim?
Good morning. I'm very honored to be delivering remarks today on this innovative private-public partnership and to bring needed dollars to our fragile rural hospital network in Georgia, which I'm learning more and more every day that we all face almost the exact same challenges. I'm so grateful for the lawmakers, Lieutenant Governor Casey Cagle, Representative Jeff Duncan, and Senator Dean Burke, and all of the task force members that have given their time and volunteering for this. and for recognizing the challenges that we face in our rural communities to ensure access to quality health care. Southwest Georgia Regional in Cuthbert, the facilities that I manage, and Phoebe Worth Medical Center in Sylvester, both were early designees of critical access. But they face the same vulnerabilities as rural hospitals across our entire state and country. We typically have an older age mix of patients, and they are sicker and often come into care at a much later time. Our facilities are also older than our urban counterparts. Cuthbert's facility is 69 years old. Worth's facility is 43 years old. Southwest Georgia Regional in Cuthbert is located in one of Georgia's poorest counties. In 2015, we provided almost $12 million in uncompensated care. And this number will increase as we continue to absorb the impact of the 2 hospital closures that were in our neighboring counties. What was once a brighter financial outlook because of critical access designation has dimmed. We have been unable to improve our facility infrastructures or add any new services. And any available cash has been directed to technology, so we're putting state-of-the-art technology in very, very old infrastructures. In Sylvester, uncompensated care topped $22 million last year, just in Sylvester, Georgia alone at Phoebe Worth. The challenges of affordability, changes in commercial payer sources, and declining government reimbursements are generating added pressure on a system that is already stretched way too thin. Like our Cuthbert Hospital, Worth has struggled to generate positive cash flow or divert to grow operations and retain staff and quality providers. We face 3 major challenges, they were just on the screen before us. The first, the high cost of implementing a mandated electronic health record system. Second, changes resulting from healthcare reform and the resulting lack of cash flow. And finally, staff and physician shortages, which most harshly impact our rural hospitals. The needed cash flow or adequate capital to influence and reverse these factors is simply not available. For example, Southwest Georgia Regional in Cuthbert and Phoebe Worth and Sylvester have both invested over $1 million each in electronic health records. For Southwest Georgia Regional alone, the long-term debt associated with electronic health records is still more than $570,000. We know that we cannot be everything to everybody, but we also know that we must be exceptional at the services we provide to our community and to deliver quality care. Rural hospital tax credits can give us a firmer footing. Donations could free up operational cash that is currently budgeted to pay our debt. We would use such donations to invest in our facilities, to make equipment improvements, and to recruit and retain a qualified staff and physicians. The donated funds will be applied to facility upgrades, inpatient rooms, in our emergency rooms, new technologies including CT scanners, telemedicine equipment, and also these are on the list of needs. We would be able to invest in our valued employees who have long been without adequate raises, and thereby recruit and retain staff for a more stable employment future. We are not able to invest in any of these things alone under the present reimbursement system. The tax credit legislation is a lifeline for us. Our citizens have relied upon us for their health care and economic vitality. Those of us who work in rural hospitals and those of us who make our homes in rural Georgia applaud our legislators for facilitating these much-needed private donations. As we look for long-term solutions, new ways to deliver care, this legislation will keep the road open by reducing our vulnerability and helping us keep essential services in our rural communities. Thank you.
Thank you, Kim, for being here today. And while we're thinking about the CEOs and the folks in leadership in the rural hospitals. If those of you that are involved with the rural hospital now that are here today and made the drive up here in support of this issue, go ahead and raise your hand just so everybody can see who you are. I think that speaks to the fact how important that this issue is. These folks need to be at their hospitals working to try to do what they need to do to keep the doors open and to keep their patients taken care of. But they're here today because they're supporting the importance of this issue, and I appreciate them doing that. I'm going to ask the members of the task force that are here today to just stand briefly and introduce themselves, you know, where they're from and who they work for, or the fact that they're working for themselves, and so that we can see the talent that we have that will be helping us with these issues. We'll start here on the left.
Gary Gregory Bridge got to Eden, Georgia. Been in the hospital authority since 1978, chairman since 1990.
Thank you.
I'm Don Betts with Georgia Tech, and I work with a group called employers like me, about 185 different employers around the state that are interested in healthcare innovations. And what I do at Tech is work with health information technology extension. Glad to be here.
Good morning. I'm Bob Dan. I'm the CEO of Azalea Health. We're a health IT company. We started in rural Georgia, started in Valdosta, Georgia. We have an office in Valdosta, Macon, and now we're in Atlanta. And we're all focused primarily in the rural market. So some of our clients are already here. So we appreciate this opportunity to help you. Thank you.
Tim Egan, 26 years in healthcare information technology, spent 26 years with an EMR company called NextGen. So I helped NextGen grow from just a few hundred employees to over 3,000, serving 85,000 docs. Determined to leave NextGen at the end of last year. I've been out consulting a little bit here recently, but am doing work for a diabetes type 2 decision support system startup here locally, and hope, I'm honored to be able to assist this collaborative, and look forward to the great things that we can do.
I'm Dennis Chastain. I'm with Georgia EMC. We're the trade association for the electric cooperatives in the state of Georgia, and obviously the majority of our service territory is rural Georgia, so we have a vested interest in the health and vitality of rural Georgia and citizens.
Thank you so much. We've also got a few task force members who couldn't be with us today, and I'm going to briefly tell you who they are. Jimmy Allen, who's from Pine Creek Turf in Adel. Rick Phillips from the Phillips Group from Tagle, and former Senator, I guess he'll always be a senator in case he's Tim Golden, who's from Valdosta and is currently in the Capital Benefits Group insurance business. The noteworthy thing I think about this group, besides the fact that obviously they're excellent leaders, is they do represent the corners of the state. We try to be inclusive, and we're still adding members. That's an important part. This is a work in progress. Our focus initially is going to be on making sure that we publicize the tax credit between now and when it goes into effect in January. We need to make sure the word gets out, and this is the kickoff of that effort. But we're hopeful that the committee will do more than that. I think that there are a lot of challenges, as we've already mentioned today, but we have a lot of opportunity of ways to meet that challenge. There are a lot of people in the state that are thinking about rural health care and improving the health of the population. And one of the things I think we need to do is to develop some sort of central organization that will kind of collate all this information and make sure we're not having a duplication of our taxpayer efforts, and make sure that we identify what those best practices are that are duplicatable. The Rural Hospital Stabilization Committee is one example of great work being done. The folks at, I think it's Augusta University, and my old alma mater, MCG, they've got a little rural task force going. And so there are a lot of folks, even in the philanthropic areas, that are doing work in this area. And we need to make sure that we pull all of those parties together. And that's part of what I'm going to challenge this advisory committee to do, is to make sure that we identify anybody who's raising their hand and trying to help with this problem, can we put them to work together rather than having a lot of silos out there working on their own. Well, after this bill passed, I visited with Commissioner Reese from DCH, and I said, you know, have y'all ever done anything about a tax credit before? And he said, no. Said, you've never had to work with the Department of Revenue? No. But they have, and I appreciate Commissioner Reese and Commissioner Riley for the work that they've done to put together the list of rural hospitals and the regulations that will have to be promulgated to make sure that we follow the directions of the legislature. And obviously, as we see how this rolls out, there may be some tweaks and fine tuning. We run into that frequently in our business that we may need to make some adjustments. But I'm excited about the opportunity. We had a lot of help from staff to put this together. I'm not going to try to name them because I'll forget somebody. I'm getting to be more gray at the temples, but I want to make sure all of you that have worked hard, obviously Donovan here that's got the really hard job of running the computer, and Laura Meadows has been great help with her folks at the Carl Vinson Institute of Government. And as I say, I'm going to stop there because I'll end up forgetting people. But these things don't happen in a vacuum, and that's been an exciting thing for me to find out how many people have raised their hands and been willing to work on this effort. Again, I want to thank Lieutenant Governor for all of his work, and I want to make sure that any folks from the media will be here to answer questions if you have any. We are looking forward to using this opportunity to improve not just the rural hospitals in Georgia, but the health of Georgia's citizens, and I think that's the most important thing. Thank you for your time today, and thank y'all.